Inflammatory disorder. Published by WordPress.com. Rheumatoid arthritis, RA. Definition: chronic, systemic, progressive autoimmune inflammatory disorder affecting joints and other organs. Epidemiology. Most common chronic inflammatory joint disorder. Age: 25 to 50 years. Peak: 40 years. Female, male equals 4 to 1. Commonly affected joints: hand, knee greater than hip, cervical spine, CS. Etiology. 1. Genetic susceptibility. More common in first-degree relatives and twins. Genetic marker: HLA-DR4. 2. Immunological. Autoimmune process involving autoantibodies, RF, against IG, associated with other autoimmune diseases, e.g., Hashimoto's thyroiditis. And 3. Infections. Viral, EBV. Bacterial, streptococci. Pathology. 1. Articular, synovium. Stage 1. Synovitis. Vascular congestion, effusion, villus formation, and inflammation, PMNs, lymphocytes, plasma cells. Stage 2. Destruction. Pannus formation, cartilage erosion, and bone destruction. Stage 3. Deformity. Joint destruction, capsular stretching, and tendon rupture. 2. Extra-articular. Salivary, lacrimal gland dysfunction, Sjogren's syndrome, Felty's syndrome, lymphadenopathy and splenomegaly, Kaplan's syndrome, pulmonary, vasculitis, renal amyloidosis, and myopathy. Bilateral, symmetrical, polyarticular joint involvement, hand, knee, hip greater than CS. Early symptoms. Pain, morning stiffness greater than 1H, swelling, warmth, limited movement, and synovial thickening. Deformities. Hand, ulnar deviation, boutonniere deformity, swan neck deformity, Z-thumb deformity. Knee, valgus plus flexion deformity. Foot, valgus heel, hallux valgus. Spine, atlantoaxial subluxation. Clinical presentation. Extra-articular features. Fever, anemia, splenomegaly, lymphadenopathy. MSK, muscle wasting, nerve compression syndromes. Skin, nodules, ulcers. Eye, Sjogren's syndrome, scleritis. Lung, pulmonary nodules, pleurisy. Heart, pericarditis, vasculitis. Kidney, nephrotic syndrome, chronic renal failure. Investigations. 1. Blood tests. Anemia, elevated ESR, CRP. Rheumatoid factor, RF, positive in 80%. Anti-CCP, highly specific. 2. Synovial fluid analysis. RF positive, increased protein, low glucose. And 3. Imaging. X-ray findings, Larsen-Dale index. Stage 1. Juxta-articular osteopenia, soft tissue swelling. Stage 2. Narrow joint space, bilateral, symmetrical. Stage 3. Bone erosion, mouse bite. Stage 4. Deformity. Diagnostic criteria, American Rheumatism Association. Raw diagnosis requires is greater than or equal to 4 of the following. Hand joint involvement, symmetrical arthritis, morning stiffness greater than 1 hour, rheumatoid nodules, positive RF, radiographic changes, erosion, periarticular osteoporosis. Arthritis of is greater than or equal to 3 joints. Management. 1. General measures. Reassurance, rest, physiotherapy. 2. Medical treatment. Referred to rheumatologist, NSAIDs, e.g., indomethacin. Corticosteroids, e.g., prednisone 7.5 mg per day. DMARDs, e.g., methotrexate, sulfasalazine, gold. Biologic agents, TNF inhibitors, etanercept, infliximab, IL-1 antagonists, anakinra. Intra-articular corticosteroid injections. And 3. Surgical treatment. Synovectomy, arthroplasty, arthrodesis, joint fusion, tendon repair. Rheumatoid arthritis in specific joints. Hip, protrusio acetabuli. Knee, Patellofemoral, CA with patellar resurfacing. Shoulder. Associated with rotator cuff tear and central glenoid wear, need RSA. Elbow. Synovectomy, radial head resection, total elbow arthroplasty, elderly. Foot. TN fusion, triple arthrodesis, hallux valgus correction. Prognosis. Significant advances in pharmacologic management have reduced the need for surgical interventions. Rheumatoid hand. Rheumatoid arthritis, RA, commonly affects the hand, leading to deformities, tendon dysfunction, and joint instability. Common deformities. Common entrapment syndromes. Carpal tunnel syndrome, median nerve. Ulnar tunnel syndrome, posterior interosseous nerve, PIN, syndrome. Cubital tunnel syndrome.